Hello everybody and welcome to the Education Training Foundation Industry Insights Workshop today for the T-Levels in Health and Science, and really honoured to be joined here today by Nicola Cook and Chris Dinsdale from Simmons Skills. So just a tiny bit about the Education Training Foundation in case you've never undertaken any training with us before. We are the ETF, Education Training Foundation. We're the expert body for professional development and standards in further education and training in England. We are also SET, the Society for Education and Training, who are the professional membership body for the FE sector as well. And we're sector owned and sector led. We're a charity. And we've been commissioned by the Department for Education to deliver the T-level professional development offer, which Industry Insights and this workshop forms part of. We're not just all about T-levels. There are lots of other elements to our mission, if you like, for you to have a look at and get involved with. And some of those are on the screen at the moment. And I'd be very happy to stay behind at the end and tell you more about some of them. And I'll also drop a link in the chat to our website so you can look into them some more. But please feel free to stay at the end. And if you've got any questions, you can ask me. I'm going to stop sharing my screen now and hand over to Nicola and Chris. Are you there? Hello and welcome.
Thanks, Marion. Hi folks, my name's Chris Dinsdale. Really pleased to be supporting the ETF here from Simmons Skills with this industry workshop. Specifically today we're going to be talking about the provision of simulation teaching for healthcare students undertaking the T-level provision that a lot of you are now providing. Who are Simmons Skills? So we're a company based out of Chesterfield, and our mission is to provide everything that you could need to be able to succeed in simulation. We're really privileged that over the last couple of years we've been able to work with over 200 colleges in establishing their T-level provision, and specifically when equipping their simulation facilities to be able to give their students that hands-on experience that they're going to need when they're out there in practice. What we like to do is provide you as many options as possible when it comes to adopting training solutions. We've produced product guides which are linked directly to the T-level curriculum to make it easy for you to understand about where you're going to be investing some funding that you may have. We like to be able to give you training options and product advice, and to be able to share the experience of other institutions that have been establishing the T-level provision themselves. We're really pleased that we're able to practice what we preach here at Simmons Skills, so I'm joining you today from our simulation suite here in Chesterfield, and we're even using our embedded audio-visual system from SimStation to stream live to you today, and we'll talk a little bit more about that later. What we're going to do before we start talking about some of the things that you can see around me today is we're going to be joined by a chap named David Paynes, who is the program lead for higher education courses over at New College Swindon, and he's going to give us a tour of their facilities and also talk later about how that's impacted on their T-level provision. So we're going to pass over to David now, and I'll speak to you again in a bit.
Hi, my name's Dave. I want to introduce you to our New College Swindon T-level area. Come on in and we'll show you around. Okay, so this is our nursing ward. So we have two wards here. So we, just to give you a bit of background, we teach nursing, mental health and midwifery. So we have separate wards for midwifery and adult, and that's literally just from, we're lucky enough to be able to timetable it that way. So this is our nursing area. So we tend to use our adult nursing T-level students in here. We have some bits and pieces out for you. So again, it's done to hospital spec. So yes, the hospital beds are there. We've got wipe down walls. We use Dynamap machines as well as manual blood pressure. We use different mannequins. So we've got, at the moment, we've got one of our 3 Juno, and we've got Aries. So Aries is more emergency work, and Juno is more for our nursing. So if we're doing things like the stoma care and the catheter care, I would use more of the Juno. When I'm doing resus and acute unwell patients, I'll be looking at using our Aries. And we're lucky enough, again, to look at software behind us. Again, it's not just about simulation. For us, it's about linking that theory to that practice. So we are lucky enough to have anatomage here. So we have an anatomage table. I've got set up for cardiac at the moment. It's a very high-tech, high-definition videos and anatomy physiology. So again, I can show the inside, if we're looking at catheterization, I can show what constipation looks like, and again just revisit the anatomy and physiology of ourselves linked to the practice. So again, especially for year one, when they're looking at doing their exam prep, we'll be looking at linking that back, because if we can make it real and make it practical in front of them, then they're more likely to remember it. Our environment has the nursing desk, so again we can run scenarios. We have a working sluice at the back, so again it's that full immersive impact we have. The most vital piece of kit in front of us is our mannequins and on our beds, more especially. Gives that realisation of someone on a bed, being used to being on a bed, putting the bed rails up and actually seeing what it feels like to be in it, moving them up and down when people are blindfolded, so we make sure we communicate effectively with patients in beds. Those sorts of really simple stuff is really key for our students before they go out on placement. Okay, so as I said before, we have maternity T-level, so come on into our birthday suite. So one of the things that I would advise that we have managed to do it here is we've worked really well with the company to support us in developing this area in regards to equipment and in the environment itself. So yes, this is a birthing suite. It is probably the biggest birthing suite in the UK. We know that's not realistic, but it allows us to teach. So again, with our midwifery students, we're assisting the midwife. So again, we would play the midwife, we do the delivery, we do the other bits and pieces. So yes, we have a mannequin that is can give birth to another mannequin, very advanced, and unfortunately comes with a big price, but I understand that. There is other ways you can do this, but with Lucy, as we call her, she can give those deliveries, we can do those bits and pieces. So we can show forceps delivery, which has been done recently because the forceps are on the side. We can go through other bits and pieces, but Lucy also can be a non-pregnant mannequin, and she is very advanced in the way that her pulses are hidden, unlike most mannequins where you can see where they are, those bits and pieces. You can catheterize her, bowel sounds, all those sorts of bits and pieces. So there's lots of things you can do with her to enhance it. She's on a birthing bed. Again, it's one of those things, so again we can immerse our midwifery students in that environment so they get to see what a birthing bed can do, why it can move, put the stirrups up, all those sorts of things. Lucy can actually give birth on all fours, so again we have a birthing mat, so we can do all the different positioning. We can look at her needs. We have a feeding chair, where again it's like a recliner, but again it's an official maternity one, so again we can put her in after birth and we can get to talk through and have conversations about what's the next steps, anything they're worried about, anxiety, all those bits and pieces, so all those sorts of things. We have a resuscitator in here, so we have managed to get a resuscitator, so again we can simulate an unwell baby being transported over to a resuscitator, and they therefore we can then simulate what would then be done next. And again, we're not expecting our students to be able to pick that up and do that themselves. We want to immerse them in that environment so they can be helpful to the professional at that point. The other important thing that I think we've got that happens to be in here is our resuscitation trolley. So it's a full simulation trolley, so there's nothing real in here. Make that really clear to students. So it basically has all the kit in here that you would have in a resusci trolley. Again, I'm not expecting our students, we would teach our students to use all the stuff in here. But actually I had a really good scenario where we had an adult nursing student went out onto placement. On their second day on a ward, there was a full crash in front of them. Obviously everything around them was really manic. There was a full debrief afterwards, but that was done as part of the team. And therefore, actually going through the crash trolley and what we use things for and what was going on and why was really useful. So for me, this has already made its way and gone, because actually we reduced the anxiety for that student. And we actually use this now before students go out onto placement and things like that. We actually talk to them, okay, what do we expect you to do as a student if this sort of thing happened in front of you? And I wouldn't expect them to be doing much. What I want you to do is get out of the way and let the professionals do it. I also don't want them to be traumatised what's in front of them. We all know it can be emotional, obviously, for these sorts of environments. So we want to make sure that we can keep them survived. So again, we will run through this sort of equipment and help them on their journey through being on placement and being in an environment where things like that are going to happen. Okay, so one of our smaller rooms is our side room. I must admit, I find this really useful environment. It is a small environment, a small room that can be easily set up. However, as a teacher, I use it for students that are a bit confused or need things repeated, that don't want things repeated in a big room with lots of people around. So I actually use this environment an awful lot. But again, it can be easily set up. So again, bed, bedside cabinet, the patient chair, and all that's in here. Yes, we're lucky enough to have the sink, but again, you can quite simply just use the alcohol jug, and we can use that sort of environment. So again, I can take people into a quieter space. It is a bit echoey in here, which sometimes does stress our students out, but again, it's just maintaining that. So again, we use this a lot within our assessment. Everywhere that we've gone so far and will do, we do actually have audiovisual recording in all the rooms. So we have cameras that pan the room, and then in the wards we have cameras that are static on the bed, and we have audiovisual recording. So over a lot of the beds you'll see the microphones coming down, and we have microphones to the ceiling. Again, that just takes the intensity of having the camera in front of you when you're being assessed. These students, as we're aware, get very stressed at these sorts of times. So the more subtle you can be with the camera recording equipment, the better for the student. So we can do that. And on that, we also have the one-way mirrors for assessment. So again, our assessors can actually stand behind a one-way mirror. So I can see the student sees a reflection of them, which means I can protect my paperwork from marking, but also it means that there's less intensity when our students are being assessed as part of their T-level or any other course we run. So maybe we've all seen one classroom, we've seen them all, but I think it's really important to say that it's really good for us to have a classroom really close to our sim suite. A lot of the things that I do with the practical is we're revisiting the theories, the models, the assessment tools, and then we go out and use them on the ward. So again, it's having that protected teaching space that's really close to your sim suite, so you can switch between. It also means if you need to, you can split groups up and use them differently. So I can have one lot in here doing theory, one lot doing practical, and then swap, or we can do several things in a row. So again, it just gives you that flexibility. But I know sometimes if we don't have that sort of space, then it's really difficult to keep everyone entertained on a ward when actually wanting to research something. So it allows those environments to remain real. When we're looking at our ESP and our Year 2 projects, obviously most of the time they do the briefing, the rereading of a kind of scenario, or they have to write their questions before they do the role play. So the role play, for instance, in the side room we just looked at, their pre and post bit is in here with laptops. So yes, we would use this, set it up as an exam room, so we divide them up. We would have the exam, so they would come to us, do that bit, go and do the practical side and come back in here, as per the requirement of that ESP activity. So this, just a really quick point, everyone's seen a storage cupboard, but it is something that's really important. So we have 3 walk-in storage cupboards that is full of all the components we need, from the wound care packs through to catheterization kits, through to the blood pressure machines and all those things. So it allows us to put things away for safety and monitoring and maintenance and those things, but it is something that's really important to think about if you're going to build or think about having a space where you have all your simulation, is to have your storage, even down to the mannequins. So we do have a morgue, as we call it. It literally has mortuary racking in it, because that's how we store our mannequins, because how else do you store a 3-foot by 6-foot mannequin on a mortuary board? Yeah, so it literally is a morgue with mortuary racking and a mortuary trolley. So again, you've got to think about how you're moving your mannequins around. They all come with lots of extra kit. So again, your mannequin comes with all the extra genitalia to change it from male to female. So where are you going to put all those boxes? If you want the age and mass so they don't all look like they're in their mid-20s, where are you going to store them? Lucy, for instance, we've got 4 boxes, archive boxes full of her bits and pieces, that from all the bits and pieces you can do with them. So it is something you really need to consider around storage of the mannequins. Okay, so one of our most dynamic and flexible spaces is an immersive room. So an immersive room, quite simply, is projectors on 3 walls, and behind the camera that you can see is an open space. So that's where my students would sit, and this would be my stage, for want of a better expression. The flexibility of this room is that any 360 image or video can be used as part of a lesson. So for example, I could be doing a lesson around people in their own homes. So with this piece of equipment, with this software, comes several different places. So this is a simple environment, a domestic dwelling at home. So I would talk to the students about, okay, what's around you, what do you need to consider if you're looking after someone or writing a care plan in this environment. and then compare that to other environments. So again, it's all touchscreen interactive. So I can either do it or I can get my students to. So I go back to the base screen. And then for instance, if I went the other way and we looked at resus, so again, how would the communication here be very different? So in the domestic dwelling, of course, it's going to be very holistic and social. Here it's going to be very here, now, specific, physical sort of things. And the thing is with this environment is I'm here talking to you about health. If you're putting a business plan together or you're thinking about how flexible this can be, it can be anything. So we have construction that come and use this space, science come and use this space. There's lots of things online that you can download into this software and use, so it doesn't even have to be about health. And again, the more flexible you can have the space, the more likely you are, I suppose, to get the money to support this. So simply happens, it's the projection and then laser is how it's done. So it is all done touchscreen. So again, you can almost use this like an escape room. So again, you can have puzzles and things and videos and information and quizzes that the students would go through as part of a lesson. So I use this space for really boring stuff. So I've got the short straw of health and safety for one of my courses this year. So actually, we know how dry that can be. So again, bringing it up and making it real for these students makes them remember it better, has that wow. But remember, if you use it all the time, you lose that wow. So don't use this all the time. Use it for those things that are special and bits and pieces. So all our simulation areas that we've got, we actually could project in here, and then we could use that as our environment. So you could use it for your assessment and transfer it from one place to another. Okay, so this is our other ward that we've got, which we use mostly for maternity. So come on through. So this is another 3-bed ward. So again, it's not unlike the other ward we had, but we use this more for the maternity side. So again, it's not just about the birthing, it's about pre and postnatal care, and we can use that for other environments. So again, yes, there is a resuscitator here, so again, we can simulate that. We have cribs by the bed. We also have a hand washing sink, so again, we have the sinks in here for a thing, but we have a trough sink, which is really useful for the students to be learning how to do hand washing and those sorts of things. So again, we have that environment in here. Again, another working sluice, that sort of thing. So we can use it for scenarios. Again, so we've got wheelchairs around, we've got all the mobility aids that are on the list, so the walking stick, the pod stick, the walking frames, the slings, the banana boards, all the things that are on our list that we have to show our students to do. Again, we can do these in these environments within rotation, so we can monitor and make sure everyone is safe, because again, some of these students wouldn't know what a banana board was. So again, it's making sure that we're all safe all the time and using that environment sensibly. So, hi, my name's Dave. I want to introduce you to our
Thanks very much, David, and to the team at New College Swindon for sharing your facilities with us. And as you guys have already heard from David, they're really lucky to have been well funded and been able to set up those fantastic facilities to be able to provide simulation teaching to their students. You'll see that in our simulation suite here, we've got examples of a lot of the things that David was mentioning, such as the crash carts. He was talking about how that can be used not only for the provision of clinical skills equipment, but also as reflective practice for things that students may well find on placement. We've also got things like hospital furniture. We've got our simulated head walls here, which allow you to have all of the functionality of the same types of equipment you would see in a hospital ward without the need for expensive and hard to maintain infrastructure. We've got things like our hospital bins and all of the things that you may not think about when setting up a simulation suite. But please do get in touch with Sim and Skills if you've got any questions or you'd like some nice impartial advice. We've got a fantastic team here in Sim and Skills who are really experienced in kitting out T-level suites, and we'd be more than happy to share our experience with you. I think it's really important though, rather than from hearing from us, to hear again from David about just the impact that those types of facilities have had on his ability to provide high-level teaching for his T-level students. So we're going to go back to David now and hear more about how the impact of those facilities have been felt. Back to you, David.
was the first challenge you faced setting up your health suite?
I think one of our first challenge was really is about where to start, where to go. We all know it's public money, it's got to be go through a tendering process. It's not, you can't just go and buy off a shop and all those sorts of pieces, especially with the money according to your college and what your limits for each stage are. So we had to develop a tendering group. So I sat on that as the health and social care expert, because I'm a qualified nurse. On that, though, is really important. So you've really got to think about what are you considering. So we have the IT director because of our AV stuff, but also, with all due respect, we talk about robots here, mannequins. So again, it's all that different thought process of how we're going to maintain things as well. It's not just about what you want to buy now. How long do you want to protect it for? So everything we've talked about here is protected for 5 years. So not only have I spent the money on just buying things, we also looked at the warranties. Some of them are quite expensive. What's the service cost? How long can you have a warranty from? What's the service commitment from all the different organisations? And that asks more questions that I could answer at that point. But it is just really thinking about, what do I need to do? What do I actually need my students to perform? Unfortunately, we do need to tend to buy the technology that does an awful lot more than what our T-level students would do to enable us to do the things we want. So every piece of kit we've got has a purpose behind it and does bits and pieces. Yes, there was things that we bought because that looks nice and shiny and new, but actually be really thoughtful about that, because actually we have got things that sit in the cupboards. We were advised to buy ECG machines, so we've got 4 proper clinically sound ECGs that are gathering dust in a cupboard that we don't use, because actually no one really wants ECG training because it gets done at work. We're not going to use that as part of a T-level, so it's around £10,000 that's just wasting in a room. So be really cautious about what do you want to do, what do you need to do that. So actually some of the things I'm stood around here are really cheap compared to a lot of things we've got in this environment, but actually these are things that work the most. Even our mannequins, the workhorse is our cheapest mannequin that we've got. It's the nursing mannequin that allows us to do lots of things and talks about different skills. So it's the cheapest mannequin, it's the workhorse, as I call her, coming out and doing stuff. And you really need to think about that.
So while we're focusing then on the equipment that was the stuff that perhaps you didn't really need and the things that have been really valuable to you, with looking at the items that we've got in front of us now, what would you say are some of your most well-used items that allow you to teach?
So it is the task trainers we've got. So yes, I've got the skin ones out. So yes, it's around making things real. Again, equality and diversity, things on different kind of skins, especially when you look at wounds, looks differently. So again, exposing these students to that, especially so I mostly do the adult nursing, but again, midwifery is the same. You can still get the issues. So we have the venous leg, we have the arterial leg, we have the pressure area. Yes, it's a bottom, but it's the pressure areas we've got the feet. It's those task trainers that sometimes actually have a real impact. Yes, we use the mannequins sometimes to apply a plaster and the dressing that we have to do, because again, it's a core skill. However, actually it's the task trainers sometimes that actually get used the most. And don't forget yourselves, so again, we role play a lot, so I do a lot of role play in my environment to make them think, and so I can react to stuff. You don't need all the tech sometimes for those sorts of things. So again, it's used, because again, if you use the tech all the time, it becomes the norm, and you don't really want it to become the norm. You want it to be something that's special and treasured, and then they realise how lucky they are as students, and respect their equipment for that.
So how did you start planning out the space? You've got a really amazing space here. How did you start to plan out what you would need and where it would go and how it would flow together?
So we were trailblazers with T-Lab, so again, they looked at what was coming, what was around at that point. So again, there was an early decision from the college that we would run the mental health, the midwifery and the nursing pathways, speaking to employers. So again, we wanted to make sure as we grew, we had space to grow into, only because we were lucky enough to have the environment and the money, the funding from the DFE to actually create this space. Go back about 3 years and it was 3 beds at the end of a classroom with things around them. So again, that's probably where a lot of colleges still are. But again, it's still using that space to the best it can be. So again, when you're looking at expanding, again, what do I need? And like I say, even that side room, we didn't think about that at the side room, but it's just something that we've got. So go and speak to someone. You're more than welcome to come here and come and see us. we're quite happy to show you around and talk to you about your experience. I went to the local HEIs and spoke to their technologists in their simulation suites. They gave me ideas. I was going to buy a lot more mannequins than I did, and then they sort of give you the realization, well, how many staff have you got to run a session? How many staff do you need to run each mannequin? So if I went and bought half a dozen mannequins or whatever, I wouldn't be able to run that in a lesson because I couldn't control them all. So again, it's those sorts of stories from the experts that really are key. So get out there and go and speak to someone around your area or your college.
So on the tour, you showed us quite a few different wards, like side room things. Do you have different areas for different teaching? You teach different pathways for your level 2s. So does everybody kind of experience different areas? Do you have certain areas for certain pathways that you're teaching?
Yeah, so our 2 wards are separated, only literally for timetable purposes. And again, it's about making sure that you have the right numbers for those sorts of people coming through. And tidying it up, it's a big space. So it's my students' responsibility to tidy things back away. It's my students' responsibility to respect the area. And it is about quality. So again, we treat it as real. So yes, we wear scrubs. Our students wear what we give, they go out to placement and we treat it as a real environment. But think about quality as well. So we actually purchase software platforms that students can access that has reference to clinical skills environment on it. So again, I've revisited my clinical skills to make sure I am at the best practice, and you need to really reflect upon that before you deliver, because when they go out into the real world, there is people that do things a different way, so you want to make sure you're confident they're going out to do things the best practice, and then we're going to raise quality across our industry.
So you said you started out with just having some beds at the end of a classroom. How long has it taken to get to the space that we see here today?
So physically built, I believe it took about 2 years from applying to opening this centre, because it's the physical build. We had a second bid, lucky enough, around the equipment, and it was actually quite tight because that was set by the funding rather than by us, and even that then took a year to actually go through a process, and up to another 6 months. So again, unless things have changed very recently, if you order a mannequin today, don't expect it to be here in a couple of weeks' time. It's going to come around the world in a crate on a ferry or cargo ship from a long way away. So it's planning those things in. And really, but saying that with mannequins is looking at limitations as well. We still use real people in our assessment at the moment, but we use the mannequins more for our formatives and bits and pieces like that, because then that frees me up as a teacher to teach. Where when you go to assessor, we're in a different mindset, we're in a different role.
So you said then again about lead times of mannequins, got to have your expectations there, because they can take a while to get to you. That would be a challenge. Were there any other challenges that you faced when you were getting ready to teach T-level health?
Yeah, try not to spend too much money when I also had a lot of money to spend. So again, it's prioritising what you want. What will I use the most? What's going to have the biggest impact? And that may not be the biggest expensive item. So like I say, the things I'm stood by actually are fairly cheap, but actually they get used a lot. So really think about where you come from. You might already have some bits and pieces. So we had manual handling equipment, so we didn't repeat that. We built upon that and made sure we had enough. And looking at things, think about what you've got. Do you need something that's new? Can you have second hand? So actually, before we bought this, our 3 beds and medicine cabinet and some manual handling equipment actually came from a care home that was shut down and someone was just selling it off on a certain site on the internet. So again, it's applying for that, making sure it's safe and sound, of course, we've got to do that. But again, don't buy the best thing. Think about actually, will the best bed make a difference compared to an electric bed that goes up and down? And one thing we haven't done here, this is all hospital, there's no home environment. So actually, if I was looking at it again, would I have a bed, for instance, that looks like it's from the patient's own home, and then we would have a corner of a room that's got a carpet on it and maybe a sofa. So there's always bits and pieces that you'll pick up, and it never stops. Restocking this costs money. Keeping this tidy costs money. So again, it's thinking about how you're going to do that. So we have a technician 2 days a week that basically keeps everything clean, fresh. So we'll put the mannequins out for me as a teacher, put them away afterwards. But if I'm using them for catheterisation, they need to empty the urine bladder in the mannequin and clean it out. They need to make sure that their skin is well maintained. because otherwise they'll start ripping. They're monitoring them, making sure they're still on, going through all the service stuff. There's actually a lot to do, a lot to audit as well, making sure we're not going to run out of stock. Especially with the ESPs coming, we're doing lots of practice at the moment, but we need to make sure our stock levels are good enough that whatever comes to us, when we get told from NCFE what we're doing, we've got it in stock, we're not panic buying.
So as we saw on your tour, you've got a good couple of storage areas, you've got the morgue as well. Those behind the scenes things are often the areas that people might not consider when they're thinking about their suite. So what would you say to anybody getting started, what they need to think about in terms of storage and maintenance?
It is. So maintenance-wise, again, everything, so beds are Lola, so again, they need to be assessed as per the law. As for storage and things like that, we try not to keep our mannequins out on the beds, and we've even got a protected space. So this whole environment is actually key coded, so only if you've got permission you can get in. Going back to my other classroom, we'd had all classes in that. You don't want to be leaving your Junos or anything else led on those beds. So where are you going to keep them? Hence why we've got that morgue and we keep them there. We've got all our wound packs and all those sorts of things stored away. It does take time and space to actually make till we do that. So again, it's definitely a consideration for everyone.
And a lot of colleges either this year or next year will be moving away from teaching BTECs to teaching T-levels instead. What would you say are the big differences or the things that have perhaps been more demanding in terms of teaching and preparing to teach T-levels versus other health courses?
I think it's just the change in focus. So if you look at the content of the courses, they're very similar. If you look at the units across both, however, it's the way it's delivered, the themes, the building it into these sorts of environments, and the practical assessment. I think a lot of people get really nervous. So we have about 50 students that go through T-level every year. We're looking at having new pathways from next year. Some of us are really excited, some of us are really nervous. So again, it's the timetabling of the assessments. You get the window from NCFE, and how do you put those things in? Plan, please plan, make sure you really think about what do you need the clinical environment for, what do you need a classroom for. So like I said a minute ago, it's around if you've got the practical and the post activity. The pre and the post activity can be in the classroom nearest to your environment. It's just the clinical bit that needs to be in an environment. And does it need to be an award? Does it specify that on the scenario? Or actually can it just be in a corner of a classroom that you make look like someone's home? It depends on the scenarios we get, but again, you can try to keep the spaces as bare as you can in a way, because then they can be as flexible as you want them to be.
Okay. So what would you say would be the piece of equipment that's had the biggest impact on your teaching?
Probably the mannequins, on my teaching especially, because it allows me to have that person that we can do things to that you can't do with a bunch of 16 to 18-year-olds. So things like actually going through personal care. Actually, because you have a mannequin and the first thing a 16-year-old asks is, have they got the right bits for that gender? Well, yes, of course they have. And then they have a little bit of a giggle. But again, the thing is treat them like real people. They all have names here. We talk to them like they're awake and they're talking to us. And as soon as you do that, it sounds really weird that they sort of forget their mannequin a little bit. So you'll notice maybe some of our mannequins have got tattoo sleeves, or they've got nose piercings, or they've got bands in their hair. As soon as you make them a bit less standard mannequin, the more they'll go in. And as soon as they do that, they'll practice better, and they will embed that quality into their practice, which I find is really good.
And have you found with any sort of immersive practices that you're doing, whether it's mannequins or the environment, that really supports the students when they then go on to their placements, that it's a fairly familiar environment?
100%. So yeah, very much so. That if they're here and they're used to that environment, like that crash training scenario, where if someone's been really traumatised by something, we can talk them through it. Again, getting used to that, putting them in a bed, putting them in, and putting the bed rails up, and then they realise they actually can't see anything, and move the bed. So again, it's making them think when they get there, actually, how do I communicate with my clients? How do I do that? And again, that does come back to make sure you treat this as a real environment. They wear if they don't wear a uniform, they don't do the practical that day. We have books that they get signed off, so we can track what they're doing. They don't get that signed off, we are tracking them. Like, why is this not signed off? Why are you not doing stuff? And it is that sort of link with the employers to, do they do the induction as a member of staff? Because some of our employers do make our students do induction, some don't. So again, is there things that we need to think about to bridge that gap? What would they do in induction? What do they need to know? More importantly, what's their limitations? What do I not expect a T-level to do on a hostel ward, in an emergency department, in a care home? Because that's actually just as important as what they can do.
That's great. Thank you very much for letting us tour your wonderful health suite today.
No worries at all. Thank you.
Thanks again, David. Really valuable insights there, and hopefully you guys watching will have taken something away from that. And again, we're more than happy to discuss in more detail if there's things that you want to follow up on. So, in my experience, which is led me to be lucky enough to work both as a paramedic and also as an academic teacher and a guest lecturer at colleges, is I've seen the valuable impact that it can have the right facilities, the right equipment, the right technical support, for example, to deliver programs using simulation. But also something that we need to bear in mind is just how important it is to link that to the curriculum. And I know that with the T-level curriculum, for example, you've got specific requirements that you have to meet. And what I'm going to do now is I'm going to give you some examples, just simple examples about how enhancing your program with some of the simulation equipment and facilities that you've seen can help you meet those curriculum requirements. So for example, you can see around us what we've tried to do is we've tried to replicate the environment that the students will experience when they're out potentially on placements in hospitals, in care homes and other provision. But also what we've tried to do is enable you to be able to have a real flexibility in the teaching that you're going to deliver. So for example, you've seen all of the facilities, but what we haven't done is introduced you to Juno here. Now you heard David talk there about how the value of the mannequins and how that's brought to his programme some real flexibility in teaching. Well, Juno here I'm going to give you a little bit more insight to, because this is one of the most popular things that T-level colleges have actually adopted, and I'll give you some examples about how that can help you meet some of your curriculum requirements. So Juno has joined us today wearing one of her optional realistic face masks to give her that appearance of a geriatric male. Straight away you can see that's going to enhance your simulations to be able to show a real diversity of patient. But also what we can do is we can think about how this type of equipment helps us to meet such as your A7 clinical practice 6 C's of patient care. Juno has been developed by a company called CAE, specifically to help an undergraduate health and pre-registration nursing program, for example. So Juno has been developed to allow you to investigate all of the issues around compassion, care and dignity in care as well. She allows students to do things as simple as personal hygiene, for example. So using things like ear cleaning, ear irrigation, eye irrigation, bed bathing, very simple moving and handling as well. So you can use Juno for all of your moving and handling and your health and safety requirements. Juno allows you to do things like communicate with her. She's able to give vocal responses, you're able to speak through her, to give a conversational response as well, so you can start to investigate that health and well-being and to recognise the signs and symptoms of a person experiencing pain and discomfort, for example. Juno's been designed so that you can practice various clinical skills on it. So you can practice things like the management of an airway, the use of suction, the use of feeding tubes, the ability to use things like intravenous cannulation, intramuscular injections, lavage, gavage, things like catheterization with urine output, so your students can start to understand that a patient that potentially is in long-term care may have multiple different observations that need to be done on them, and the importance of those when recognising things like normal expected ranges for physiological requirements, physiological measurements, which are some of your core science concepts as well. Juno's able to replicate both male and female patients, so just by changing things like her wig, her chest skins and her genitalia, again allow you to investigate how things may differ between the different genders. What we've also got is the ability with Juno to use things like the software that controls her to show different physiological parameters. So we can practice things like doing manual blood pressures, of taking pulses, things like listening to chest sounds, listening to heart sounds and bowel sounds. And we can help students to understand when something's normal and when something's abnormal, so they can have all of that assessment, recognition and escalation skills before they get in front of a patient. Really, really important to enhance the confidence of your students, to obviously minimise the risk to patients when your students finally get out there and manage to get hands-on with patients, and also to get them more ready for the placements that they may experience. So that's Juno. She's a really, really valuable addition to your curriculum, and what I would definitely say is get in touch with us, and what we can do is give you more insight and more experience with how the different mannequins can add, and also how you can get the most return on your investment, because when you do get this funding, then it's very important to spend it wisely on the things that you're going to get the most use out of. And like David says, you want things that are workhorses, things that are going to provide you a return day in and day out, and really give the student that really positive experience. One of the other things that I mentioned earlier is we're actually using our audio-visual system that's been developed specifically for simulation teaching by a company called SimStation. So we've got the audio-visual cameras and microphones built here into our simulation suite. And what we're going to do is we're going to show you the fact that we're actually streaming live through the SimStation software. And I'm going to move across now to one of our other little setups, so you can see some of the other products that we can offer using the SimStation system. Now, when using the audio-visual systems, you need to think about that, how that helps you to meet the requirements for your employer set projects, how you can record your ESP assessments, for example, your scenarios. You get cameras, you get audio capture as well, and the ability to save in MP4 formats, which will meet that NCFE requirement for storage and submission. So hopefully you can see now that we've also just got a selection of some of the 10,000 products that we're able to bring to you here at SimSkills. And one thing I will say, if there's things that potentially are a little bit weird and wonderful that you've heard of or you've seen, do get in touch with us, and I'm sure we'll be able to help you. So for example, we've got things like our nursing kits. What these do is they give you a range of very simple task trainers, so your students can start very low cost to try and experience some of those clinical skills, right down to things like wearable glucose fingers. So when they're starting to think about taking blood sugar measurements, you can have wearable devices so they can really feel what it's like to undertake those skills. We've got things like our catheterization trainer, our intravenous and venipuncture arms, and again what it will help the students to understand the skills and procedures that go along with some of the things they'll see out in practice. We've even got things like our hand hygiene trainers here, which will help you meet your infection prevention and control measures. What this allows students to do is to see just how effective their hand washing is in a very simplistic format by placing their hands underneath the UV light using a special gel and seeing just how hard it is to get your hands truly, truly clean. I'm also joined here by my glamorous colleague Mark, who is demonstrating one of our wearable geriatric empathy suits. So we've got this type of wearable suit for pregnancy, for obesity, and as you can see here, for geriatrics. Now what this will do is will help your students to have that increased understanding of the changes that occur physically with the aging process, and also to enhance their empathy and their understanding about the effect that this can have on someone. So you'll see here Mark's wearing a suit which reduces his mobility, increases his weight, mimics things like muscular atrophy, and also things like changes to his vision. So again, there's all sorts of solutions which can be really engaging and really interactive for your students. So do get in touch with us and we'll tell you exactly what we've got and how we can help you. Okay, so that's a real kind of short look around some of the facilities that we've been able to help colleges such as New College Swindon to establish, and also some of the things here as a very, very small example of what we here at SimSkills can do to help you when perhaps you're setting up your T-level programme for the first time, or whether you're trying to enhance the provision that you've got. Please do come and talk to us. Like I said, we've got all sorts of resources, and we're going to continue to engage with you guys as a community and to listen to what it is that you need. We've got colleagues such as Dan Bloods joining us, I know, on the call from one of the universities, who's really keen to start kind of helping colleges that are having their 16 to 18 year students who want to advance through to their university education, and he's got a wealth of experience to help as well. So do reach out to us, we'll put you in touch with people who can give you some great insights. What I'm going to do now is I'm going to pass back to Marion, and I think there's going to be some time for you guys to ask any questions you've got, or to share any experiences that you've had yourselves with the amount of colleagues that you've got on the call today. I'm sure that'll be very, very valuable. So I'm going to thank you very much for joining us here from Simmons Skills, and I'm going to pass back to Marion.
Thanks, Chris. Wow, that was incredible. I can't believe all those facilities and all that technology and everything that is available there. Thank you very much for that indeed. I'm going to stop recording just for a second. So those of you that are watching this as a recording, we're just going to have a live Q&A now, and then I'll be back to tell you about future things that are coming up. So see you back soon. Okay, so those of you who have just joined us back on the recording, or you're on the recording watching it, we've just had a fantastic Q&A session with those college joiners from Sim and Skills, and do check out their website. If anything you've seen today on this recording has made you think, oh, I really want to learn more, or I need more support, or I need more help with something, or I want to be advised on how to use my Juno model, or I want to be advised on what else it is that I could purchase to support the T-level teaching, then please check out their website and get in touch with them, because they are more than happy to help. So just going back, this is our T-level professional development offer. So there's more to our offer than industry insights. So please feel free to explore that. And with regard to Industry Insights itself, just wanted to remind everybody, you can go out on an individual placement yourself, or go out with colleagues yourselves and do a kind of industry day, if you like, or a back to industry day. You organise these yourselves, but we have remission funding at £400 per day for your college or school for you to take part in those. So do get in touch with us if you would like some more information on those, and our email address is going to be at the end. You can go out as an individual, that's the top left square, or as a group, that's the bottom left square. We also organise group industry placements, predominantly online, but sometimes face-to-face as well. They also pay the remission funding. I'm going to tell you what's coming up in a minute. And we also organise more workshops like the one that you've just joined today live, or booked to watch as a recording. So at the moment, if you want to book to view as a recording, because these have already taken place, so we had workshops on endometriosis, on electromagnets in nuclear fusion, on Crohn's disease and genomics, on cancer and genomics, on cancer and developing targeted cancer treatments. And of course, if you're here live today, you will receive a recording of this workshop. But if you're watching it, then you've already booked it. What happens is, after we've had a live workshop, it then goes into our recording section for people to book. It takes about a week to get on there. So we've got a live workshop coming up, Healthcare Science with a biomedical scientist from Whittington Hospital. That's on the 14th of March. We've also got group industry placement coming up. Those are the slightly longer sessions. So that's a woman's midwifery journey with Guy's and St Thomas's NHS Trust. That's on the 8th of February. And we've also got professions in the NHS on the 12th of March. Now, those group industry placements are not recorded, so do join us live for those. You cannot book them to view afterwards, so join us live for those. We do really want to hear from you. We want to hear if our sessions are successful, if they've helped you. So if you're here live today, please point your phone, if you've got one, at the feedback survey QR code, and then you can fill in our survey and let us know what you thought of today, and we can make sure that our workshops reflect what it is that you want to learn more about in the future. If you do want to get in touch with us, then there's our email address, industryinsights@etffoundation.co.uk. And one thing we're always interested in is hearing from you as regards to what kind of topics you would like us to cover in these kind of workshops. So do let us know if you've got any ideas of something you want us to cover. Let us know, and we will try and find the right kind of industry professionals to come and talk to you about it. I'm just going to stop recording now. Thank you for joining us. If you've booked this recording, I'm going to stop recording now, and we hope to see you again at one of our live events.